Dr. Fox, cue the intro.
Hey, welcome everybody. This is our Best of Health series, and we're going to be talking about people who are in their 60s. So if you're in your 60s, or you know someone that's in your 60s, call them real quick, get online. This is the video to watch. We're going to go over nutrition, exercise, sleep science, and stress management. I'm Dr. Kevin.
Hey, I'm Coach Sean.
And we are the FitHealth Pros. Today's video is about nutrition, exercise, sleep science, and stress management when you're in your 60s. So we're going to give you a few different things that are tools for success. If you've been watching our series, you know that we've been going through the decades and we've reached up into the 60s. So let's start out with nutrition. So go ahead, Coach.
Nutrition, number one. So nutrition is one of the most important things that we need to focus on as you get into your 60s in terms of your best health. Your need for extra calories is going to decrease because your activity levels are going to start decreasing, your metabolism is going to start slowing down. But in the same vein, your need for the same or greater amount of nutrients starts to increase. So there is less absorption of some nutrients as we get into our 60s. So nutrients such as vitamin D, calcium, B12 may need some extra supplementation. Speaking of vitamin D, you get less absorption of vitamin D through sunshine. You know, that's generally where we get most of our vitamin D needs is directly from the sun. Yeah. So you are going to want to possibly look into some supplementation for, say, like a vitamin D3 supplement to help with that. Also, with that slowdown of metabolism, you may start seeing some excess fat storage. With that excess body fat, there can be an increased risk for heart disease and type 2 diabetes. Now, one good thing, even when you start showing signs of insulin resistance that can lead you down that slope toward type 2 diabetes, if you have more whole grain foods, vegetables and fruit, plus add on some extra exercise, you can actually delay that onset of type 2 diabetes. So we can reverse trends and slow down trends just by being a healthier person. So we're going to want to look to eat a wide variety of the 5 food groups. Limit saturated fats whenever possible. Healthiest foods possible. Try not to start getting on a hamburger diet or on that beige diet that Dr. Fox likes to talk about.
Right, exactly. and it's easy to do as you get older. If you're retired and you have, you're meeting your friends at McDonald's, it's easy to do that, and you just still need to be conscious of those healthy habits.
Yes. Now, 2 things. You're going to want to keep your eyes on your blood work. You know, when you go see your physicians every year or even twice a year, get your blood tested and figure out what you are going to need nutritionally. For instance, if you have a risk for high blood pressure or you already have high blood pressure, going to want to increase that potassium, going to want to decrease your salt intake. In terms of potassium, some of the simplest foods that you can go for are bananas, sweet potatoes, spinach, different things that you may not have had a flavor for in your younger years, but now are pretty delicious.
Nice. Yeah, all those are good. I notice that in my practice, a lot of the patients that come in, they're tight, their muscles are tight, and so we're recommending potassium, calcium supplement. That those two go together really well to bring that down to hydrate you as well.
Fantastic.
So just the chemical makeup helps relax the muscles and gets that
tightness.
That tightness. Cramping is really where people will come in and they say, I have leg cramps during the night. And so
hit that potassium, especially for cramping.
We're recommending that potassium all the time. The other thing, going back to the absorption, we recommend, well, there's a couple of things. So digestive enzymes.
Sure.
So if you do have allergies, like a dairy allergy, you want to have that enzyme, so the lactase may be put into the milk, so the lactose-free milks, or you can take a pill that has lactase. There's other things, amylase and propylase and
Bunch of aces
There's a
for you.
bunch of aces. So do that. Those are all good, and you take those when you have your meal, not between the meals.
Perfect.
So that helps with that digestion and absorption.
Boom.
So
That was Dr. Fox, by the way.
yeah. So if you like that, and here's our plug spot, right? It's time to plug the FitHealth
Pretty
Pros.
much. Go ahead and subscribe to this YouTube channel. Hit the like button on this video and any other videos that you may watch in the series or outside of the series for the FitHealth Pros.
Yes.
So that was nutrition.
right.
We're going to move directly into exercise now. Best exercise for best health for the 60s.
Absolutely. So with exercise, some of you may just be getting back to exercise. Some of you have done it all your life. But what we want to do is we're just looking to get some extra movement when you can. So if you have the chance to walk a little farther, so park a little farther out from the store so you can walk in. If you have a chance to walk up the stairs instead of take the elevator and you feel confident that you're not going to fall down or hurt yourself,
Right.
do that. You know, I don't want to say you have to. But any movement, what that does increases your blood flow, gets your body moving. When you walk, there's been studies that show, well, physiologically it shows that you increase your cerebral spinal fluid, and that helps with nerve function up and down your spine. So many good things with just getting that movement. So some of the recommendations are going to be resistance training. So what's that mean? Well, you may or may not want to use some hand weights, or something like a body weight is fine. As we get older, those bones become less dense, and it's been shown that resistance training increases bone density. Balance training is important as well. You may have noticed you get a little more wobbly getting out of bed, or if you're standing at the kitchen sink, you turn real quick, you may feel like you're losing your balance. There's a couple of reasons for that, but if we can train ourselves, we can figure out, is it just my balance centers needing to be worked, or is it something like an inner ear infection or other things that you have to go to the medical doctor for? Muscle, connective tissue, all of those things need to be worked out. Make sure that your core strength is being improved upon as well. That's going to reduce your risk of falling and other injury too.
Oh, yeah.
All right, moving on. There's a lot here for exercise, so
There is.
here we go. We're going to post this on the board as well, so we'll give a link to this. So we want to increase flexibility and mobility. So if you're feeling like your joints are real stiff and your legs are stiff, dynamic stretching, which is a movement type of stretch, is going to improve your range of motion. Expand your regimen to have a greater variety of movement. I'm going to go into also recommending the multiplanar moves. So those are going to prevent binding and stiffness of your muscles and joints. So what's that mean? So multiplanar, not just forward and back.
Forward and backward.
So we want to do some side bending,
Want some rotational,
rotational, and then you want to incorporate your extremities into that as well. So things where you're moving your shoulders and your arms and your legs. That also is going to provide some of that dynamic stretching that we talked about.
Try to utilize all of the range of motion of specific joints, your spine, your neck, safely.
Correct. And I see people all the time that they're coming in for a certain pain, and we ask them to lift their hand up or check their shoulder range of motion or their neck range of motion, and it is what they think normal, in air quotes, right?
Right.
And
Normal for them.
normal for them, and
Sure.
there could be some degenerative arthritis forming there that blocks that, or you may have had a knee injury which blocks that. But usually after some exercise, after some stretching, after joint mobilization, we find that those other areas that they thought they never would have mobility, that improves sometimes 50-60%. And that can change a big deal, because now the ability to reach up and grab things, the ability to turn while you're driving, that takes some of that fear factor out of there too. So now you feel more confident. Things I like to recommend to the patients as well who are in their 60s, protect your lower back. So my recommendation is to do mobility exercises and keep the low back mobile and move. Standing up, sitting down, all of those things. Avoid sitting for long periods. So going back to either patients or even parents,
Sure.
for us,
Sure.
I know that my mom sits at a computer chair a lot of the day, and she does now with recommendations from the chiropractor that she sees on her side of town.
But not you.
But not me.
Yeah.
But I have to, it would be me if she was here.
That's true.
But I recommend great doctors or colleagues to take care of my mom.
Yes.
Yes, and I take care of other people's moms.
It's true.
That's how we balance that.
It's true.
But sitting is really bad for the low back. We don't want to have pounding and bounding, so things where you're on hard floors all the time. That's a big thing.
Careful compressing the spine.
Mm-hmm.
You know, all the percussive forces you want to stay away from if you can.
Correct. So no high intensity training that's all the rage. All the rage.
It's true.
So one of the things too in your 60s is we find that the injury possibility is definitely increased. So it's easier to injure yourself, and it also takes a lot longer to heal.
Yes.
So we don't want to put ourselves in that position. Sometimes can't help it, but let's try to avoid that as much as possible by doing those other things that we recommend. If you're new to exercise and you have questions, because some people just never start because they don't know where to start, the biggest thing is to find someone that is qualified, that has a background in training somebody in your population of your age group. If you're going to your physician, they may know somebody. So if you are going to the doctor regularly, it doesn't hurt to ask the physician. Don't expect the medical doctor to give you all the recommendations, but if they have someone that they can refer, because it is a specialty. It really is. You can go online. I'm not opposed to that.
Sure.
Do your due diligence.
Just make sure that they have the proper education, the proper years of experience dealing with issues that go along with folks in their 60s. You may be in your 60s and actually be in really great shape. We're talking more along the lines of the median in the 60s of health overall.
Right. I mean, we know that from a physiological standpoint, these things that we've discussed is a true thing that happens over time. So you just have to be aware. And if you've been a lifelong exercise person, keep it up. I mean, I do have patients that are playing pickleball, regular tennis, they're riding bikes, they're hiking, they're doing kayaking, and all of those things are all pretty good. Some of them are a little more intense than others.
Sure.
But
they were doing it in their 30s, 40s, and 50s before hitting their 60s as well.
Right.
So it's not necessarily the time to take up motocross if you've never done it before.
Right. And just on that note, I've seen those patients as well think that they can continue, and unfortunately sometimes the injury that they have could have been prevented if they just didn't continue at that level. So start being aware. Those are the recommendations for exercise in your 60s. So the next subject matter is going to be sleep science, and it's really important. So let's get into that.
So when talking about sleep science for the 60s, now some of these issues may have begun in the 40s and 50s and are just kind of emboldened in the 60s. But you could start or continue to have issues falling asleep and staying asleep, along with other maladies such as insomnia, sleep apnea, things that may not have bothered you in the 40s and 50s may creep in during the 60s. Your amount of sleep can decrease nightly. In terms of men, 20% of men in their 60s are in full-blown andropause, which basically means that your testosterone levels are much lower. The body is having issues creating enough testosterone to keep that vigor, to keep that energy going. So that can affect sleep. It also can drop your energy. It can lower your moods. So if you feel like you're cranky in your 60s, that may be part of it. You know what's interesting, transversely, when I'm talking about women in their 60s, now this is the first decade, full decade of postmenopausal life. So you may actually be getting better sleep than you did in your 50s and late 40s. There's a settling of those hormonal shifts, so you're able to sleep like a baby now. You're not getting the hot flashes, you're not getting those shifts up and down in mood that you were having during those menopausal years or even perimenopausal years. But overall, in the 60s, we see a lot more restless and fragmented sleep, less deep REM sleep. And that's why it's so much easier to wake you up in the middle of the night just hearing a sound. It can also be harder to fall back asleep once you get awoken too. So you want to be careful of just kind of setting a regular sleep pattern, creating a better sleep environment, maybe a darker sleep environment, a quieter sleep environment. Also, make sure you're getting some sunshine during the day, can help raise that melatonin level a little bit as well, and reduce stimulants later in the day as well. No coffee or caffeinated beverages after, say, 1 or 2 o'clock, depending upon what your regular sleep pattern is. If your regular sleep pattern is, you know what, I'm going to go to bed at 7:30, 8 o'clock, then take it back even further than 1 or 2 o'clock, because it can really affect how you fall asleep and just how restful that night's sleep is.
All right, yeah, very good.
So, from sleep science, we're going to talk about something else that could have an impact on your sleep, and that is your overall stress. So in order to manage that stress, we're going to go into some issues that many people in their 60s may have stress-wise, and hopefully find some solutions for you as well.
Yeah. So, you know, stress management in all our series, it always seems like a negative, but there are positives out of this, and that's why we bring it to you. But we want to make people aware. We know that if we say something that you're aware of that stress. So here's the thing, when you're in your 60s, you may start having more health problems. You may have physical limitations. You may have friends and family who are passing away. Those things are definitely starting to enter your life at that time, and that can be stressful. Finances can be stressful, not where you want to be, not where you thought you were going to be. Also cognitive decline, when you start to have that, or a family member, that can really put a lot of stress on family members and relationships. So you're trying to handle that best you can. Work stress. So this is an interesting one. So half of the U.S. workers, workers who are in their late 50s continue to be employed to 63.
To age 63.
Is that correct?
That's correct.
All right. And there's less than 1/3 of people 65 and over that are working.
Right.
Now, a lot of that has to do with kind of the Medicare age. So you may be doing things that you like, so labor of love jobs, more creative jobs, part-time jobs. So that's where that definitely falls in.
A majority of those at 65 or over that are still working, they like what they do. They like what they do. You know, when you're talking about that Medicare age, you know, it is almost psychosomatic that when we start getting closer to 65, that we're just going to go ahead and hang it up. You know, going to go ahead and say, you know what, I'm retiring because they say that's the retirement age.
Right. Yeah, and that I could definitely see where that could be a stressor. And my recommendation there is to really start focusing on getting rid of the word retired. I think that it's been kind of overblown, and there's a lot of different things that we do at a certain age, and let's say we're not working at the job that we're doing, we still want to be productive and do something. So that way, we don't have as much work stress. It's just things that we enjoy at that time.
Well, especially now that people in their 60s, 70s, and 80s are so much healthier at times, because they've already implemented a lot of the things that we've talked about today.
Right. All right. So some other negatives.
We're back to negatives.
Back to negatives.
Well, we're peppering in some positives, and then we're gonna bring it home with some positives too.
Correct. So you may have teeth grinding. We notice that happens. Forgetfulness, anxiety, heart and blood vessel issues, vein issues. So the 60s are really the time when a lot of these health problems start to come to the forefront, and that can be very stressful. Another thing is related to alcohol and drugs and tobacco. If you're in your 60s and you don't have a job that you have to report to, you may find that you're drinking more often, whether it's socializing or you do those type of, what do they call that? Tobacco and drugs and recreational type of things that just kind of take pressure off of you. And that can definitely be a two-edged sword there.
It can relax, but it can also be addictive as well.
Yeah, and if you're trying to get, and I tell people who come to me and ask for wellness advice, a lot of the things we do aren't to make you live longer. There's a lot of, no one's going to say, hey, I can make you live to 125 or past 100. But it's the quality of life.
We're looking to increase quality of life. Healthier you are.
Right. And if you're drinking excessively, if you're smoking, we know that those things are going to shorten that and affect your quality too. So it may not shorten your lifespan, but you don't want your last 10 years to be dealing with that.
A lower level of quality.
So let's see. So what do we want to do? Well, eat healthier, get exercise, and have a positive outlook on life. Laugh, enjoy. All of those things really help. Get away to a spa, meditate. All of those things that just get your mind off of things.
Releases stress.
It releases stress.
Get rid of that stuff.
It builds endorphins, and those endorphins in our 60s, we don't have those as much naturally, so that movement and positive frame of mind is going to help with that. You can get some support if you are feeling stressed, and you can do that with family, you can do that with friends, and if you need to, you can go outside and get professional support as well.
Sure.
So a lot
of people that care, a lot of people that know what they're doing. Just make sure that you don't necessarily just go with the first person that you find in a phone book. Do some research, ask some friends that may have a good professional working with them. Just like in anything else, no two doctors are alike, no two trainers are alike, no two therapists are alike. And not everybody is going to fit specifically with your personality and your needs.
Right. So another good action is to volunteer. Goes along with that purpose again. Keep learning. With online learning classes, you can learn so much.
Anything you've ever wanted to learn, you can tap into now.
Absolutely.
And that's pretty exciting.
And the biggest thing is to think positively. The more you think positive, that breeds that positivity back, and that people will pick up on. Your friends will pick up on that, and that's a great feeling. So that really is stress management, and hopefully some of the tools that help. We didn't want to bring you down too much, but I think that we ended on a positive note.
Yeah. Well, when you end on think positively, you can't help but be on a positive note. So those are the four major areas that we wanted to touch upon for folks in their 60s to be able to live your best health. remember, subscribe to our videos, please. Go ahead and hit that like button if you liked us.
Yes.
Hopefully you liked us. You really liked us. We'll kind of see how it goes. Again, nutrition, exercise, sleep science, and stress management. If you can get a handle on those 4 things and hopefully be able to implement some of the things we talked about today, we think it'll go a long way toward that quality of life, toward raising that quality of life that we were talking about. Again, we are the FitHealth Pros. I am Coach Sean.
And I'm Dr. Kevin. Thanks for spending time with us.
Thanks for coming along. Hopefully getting a little education and getting healthier.
All right. Thanks, guys.
Thanks.
Is in the... I'm going to rewind that one.
Sure. So again, we are the best.
We're not the best health.
We're the FitHealth Pros.
FitHealth Pros.